Hi everyone, Nurse Michele here again. Today I'd like to give you the top 10 tips on being successful in taking your Pediatric Advanced Life Support Program, PALS. So the first tip I'd like to give you is to make sure that you study enough. There are a lot of resources out there to study for your PALS. Certainly, if you're taking an American Heart Association program, there's a textbook, ECC manual. I also like to recommend my zombie notes on studying PALS. So memorizing algorithms out of your textbook or zombie notes is one of the best places to start. Make sure that you have the proper manual. If you're taking a certification class, you'll have the American Heart Association Pediatric Advanced Life Support textbook. Sometimes instructors provide recertification students with the ECC book, which is a handier, smaller version of all the algorithms and information. So both those textbooks are great to have, and you have to memorize the algorithms. What you also have to be able to understand is the EKGs that are involved. So the EKGs that affect children and make them unstable certainly are bradycardia, tachycardia, and certainly there is cardiac arrest due to trauma and other problems, but there are ventricular rhythms that you have to be worried about also. So recognizing those arrhythmias and knowing how to treat them through the algorithms are very, very important. I'd like to recommend another tip, and that's watching videos on YouTube. There are hundreds, maybe thousands of videos, and many of them are excellent. Certainly like to recommend my videos on ACLS and PALS and BCLS. They're all very helpful. There are practice tests to take. Your instructor will provide you with tests. There might be exams on the internet that are offered through American Heart Association. Once you get your textbook, you get a code to log in. So retaking those exams over and over again are very helpful in helping you pass your certification program. Remember to bring the results of your exam, even if it's not a passing grade. It's nice to see that you've been trying to pass the test. So take those tests over and over again if you need to. Taking a BCLS, or I should say BLS program, before you take your ACLS or PALS program is important. You will be required to do CPR skills in your PALS program for infants and children. So you need to be prepared with, the 2-finger, the 2-thumb, or the 2-hand technique for large children. So be prepared to do CPR. And in the PALS program, there are medications that you need to memorize. And you need to memorize the dose by weight for all you have to memorize it for all ages, but it is by weight. So you have to know the dose so you can calculate the dose by weight. The most popular or common drugs that we need to memorize for PALS is epinephrine, atropine, and the infusions, epinephrine infusion, Levophed, dopamine drips. Those are some of the popular drugs. Adenosine, amiodarone, some more drugs that we use. And we learn a lot about diagnoses of the children, whether it's an airway disease, cardiogenic shock, or other shock entities. So we really have to be able to identify, assess infants and children, and differentiate a diagnosis so we could treat them properly, whether it's dehydration, infection, very important topics. What's important in the classroom, you should know to participate. Ask questions when you have them. Don't save them and then we forget about them. Raise your hand, answer questions, ask questions, participate. You will remember things more likely when you do that. Be prepared to do hands-on. Like I said, you might have to do the chest compressions. You will have to do the chest compressions. You'll have to ambu or ventilate infants and children. So be comfortable with those skills. So be prepared and you will pass your PALS program. If you have any questions, visit my website, ask questions. I'll see you on thenurseeducator.com, and thank you for visiting. Bye-bye.